know. Before we go any further, I need to ask you, it is National Siblings Day. Do you have any siblings, Wendy, that you want to shout out?
Yes, I do actually. I have 4 others.
That's quite a few. And I'm guessing they're not on the Isle of Man.
They're not. No, they're on the other side of the world in South Africa. So a shout out to all of them. If they are listening, happy Siblings Day.
Oh, when did you last see them?
Probably a good few years ago now, to be fair. Maybe about 2 years ago. But we
Yeah.
keep in touch. I mean, there's WhatsApp and all that kind of thing these days.
Are you
so-
close then?
Yes, relatively close. We're a family of 5, so yeah. And I happen to be the youngest.
Oh.
So, but yeah, we are close.
If you're the youngest of that many, you're either spoiled or abandoned.
Neither. Somewhere
Well,
in between.
That's quite good to know. Karen, any siblings?
Yes, I have a sister called Paula who is actually a cancer specialist in the south of England, and I'm forever picking her brains.
Well, that's quite appropriate because that's what we are about to talk about today. Because there's going to be a new free cancer support group, which is starting on Friday, and it's been organised through Mannin Doctors. So, Karen, we'll come to you first. Just let us know what is happening on Friday. Then, what is this going to be?
So we've started. It's going to be a drop-in clinic, which we hope to run monthly, maybe start to be a little bit more frequent. There used to be a brilliant drop-in clinic at the hospice when I worked there, and I always thought it was one of the most successful things because people just knew where to go for a cup of tea, a safe space. They could meet up with other people. They could just do something like some craft work or something that they wouldn't do at home on their own. If they needed help, there would be people there who would be able to signpost them to the right place to get that help. And if they just needed a bit of a sob and a hug, that was also okay. And unfortunately, that hasn't been available as much as it was. And so it's always been on my mind to replace it. And this is our small start. We know the Maggie Centre is coming soon, and we're hoping that if we start the ball rolling, there'll be a great community ready to move into that amazing building.
And Wendy, this is something that is so important, not just to those who actually have a diagnosis of cancer, but also to the families, because it affects everybody, doesn't it?
It does, yeah. I mean, cancer just affects everybody, families, friends, colleagues in the workplace. And so the group is open to everybody. So people that have cancer, that are going through the cancer journey, but also those that are affected by it. So it's not an exclusive group. It's inclusive to everybody in the cancer space, whether they have cancer or they've been affected by it in some way.
So for those who've not been to one of these groups, like Karen was mentioning before, what will actually be happening on Friday?
So Friday is, as Karen mentioned, it's the first of hopefully many. And the idea is for people to come along to that and to have a bit of a chat and also share with us in terms of what they need in that space. People that have been on the cancer journey, a lot of the feedback that I get from people is everything's kind of laid out for them. You know, their treatment plan is there. They go, they get their treatment. But then once that's done, there's like, what happens next? So it gives people an opportunity to come along and to share what they need and to share with other people their experiences as well, to kind of just create that space for people. And for them to tell us, you know, what we can do going forward. So there might be things that people think, oh, you know, we'd really like to, I don't know, do something with the Venture Centre, or we'd like to get somebody in to talk about, I don't know, nutrition or whatever it is. And so the aim of the group would be to kind of take that feedback and see if we can make that happen for people.
And why was it important for you to do this then, Karen? Because, I mean, we know that, as has just been said, there is a need for it, but why did you particularly want to do it with Mannin Doctors?
So I have worked on the Isle of Man since I was a medical student in 1989, and I have always worked with the purpose of my medical career has been to look after the patients on the Isle of Man. And I know that that's difficult at the moment, and that's why I had to leave the NHS and start Mannin Doctors. But we have a very strong community ethical view, and we already donate to island charities, And this is the next step, is being able to provide things for everybody, not just people who can afford to pay. So we have this space, this room, and we're going to be doing hopefully other things like this there. We're already using it for running first aid courses. We've had some fantastic children's first aid courses over half term and things. And it's about building that community and helping people understand that as a small island, we can do things that you can't do in the UK. We don't have to follow their healthcare system. We can be much more inventive and much more proactive.
That's a really good shout, actually. Yeah, so there'll be many more events. So it's Friday at 11 a.m. at Tower House.